Thank everybody for joining the Greater Burlington Partnership call with Debi Durham, Director of the Iowa Economic Development Authority. Debi, I want to begin by simply saying thank you. You, the governor, the governor's cabinet, I know you folks are just pouring it on, putting in lots and lots of hours on behalf of looking out for Iowans, and on our behalf, just thank you for looking out for us. I hope you're taking time to rest and take care of yourself somewhere along the way.
Well, thank you very much. Actually, I have to say it's been intense, but I think we feel it, we know that we're making a difference. And I think when you feel that you're actually moving things forward and you have a plan, that certainly makes all these hours worthwhile. Plus, I have an amazing team, and 90%, probably 95% of our team is working remotely, and we haven't missed a beat. If you think about, we're standing up new programs that we've never done before, getting money out the door in record time. It's pretty, I have to say, it's pretty heartwarming when I see the hours that my team is putting in. And in many cases, I have to tell them at 5 o'clock, they need to stop, because, when you're working at home, one of the biggest challenges you have when you see so much need and so much work that needs to be done, part of the biggest challenge is having people actually know when to turn it off, when, there's no separation between work and home anymore. So we've been able to, we've been working through those issues, but I appreciate it. And I will certainly share that gratitude with all of our team members.
Well, thank you for that. So a little bit about our format this afternoon. I'm going to have a brief conversation with you and toss out a couple of questions. Meanwhile, we're going to invite the folks on this call to use the chat feature to submit some questions to Jeremy Hess. Debi, I know you're very familiar with Jeremy, Director of
Development. Hey, how are you?
And so Jeremy is going to field those questions in a few minutes and put some of those in front of you. Sound okay?
Perfect.
Great. So I'm curious, I've been hearing a little bit about plans for an Iowa Recovery Task Force. Can you tell us a little bit about what the goals of that task force are going to be, maybe timeline, what industries are going to be represented?
Certainly. So basically, it is the governor's task force, and she will actually be chairing it. It is all about responding. So the first phase of this is really probably more geared towards various state agencies and the plans that what we have done. It's really kind of documenting what's being done, what still needs to be done from that response stage. Then we'll begin to focus on the recovery stage, which is more of an outward-facing part of the plan, where we'll be having subcommittees and obviously input from stakeholders. And then really it's about growing. And the governor wants to make sure we come out of this stronger than ever, stronger than we were, because we did go into it with a really position of strength. We want to see that on the other side, and we want to bend that recovery curve as much into a V shape as we possibly can. So it's a really robust plan. I mean, we're going to be looking at all sectors of the economy, from, I'm saying, from agriculture, tourism, small business, large business, tax code, incentives, our delivery system of how we deliver business to Iowa. There is nothing off the table. I have to say, I think at the end of the day, I think it's going to be an incredibly transformational document for us. So I'm very excited about it.
Is there any kind of timeline around the task force?
Well, it's actually, she hasn't officially announced it. I mean, I know she's mentioned it at her press conference. She will do a formal proclamation, from what I understand. The phase one, the more internal facing part of this document, where we're really getting state agencies to get ready for this, the various partners, has already been done. I'm not exactly sure when phase two, but I can tell you there's not going to be a lot of time between phase one and phase two, because the governor is really, really anxious to begin focusing on opening up this economy, certainly that recovery phase, but more importantly, that growth phase.
So this partial business shutdown has certainly affected a number of revenue streams for the state. How is that affecting IEDA's overall operations? regarding economic development, and what are your projections regarding things like CVBs and Main Street programs and your department's ability to assist them in the months ahead? Because they've been hit pretty hard by these shutdowns.
Well, at this point, the legislature will go back in session probably for a day or two, a very short period of time. And I don't know when that's going to be to close down, basically. And they're only going to deal with what they have to deal with. At this point, we have not seen any indication, but I also want to temper that because we really haven't seen the revenue numbers yet, right? So we're just now beginning to see revenue numbers that are going to give us a better picture of what we're seeing, right, with the downturn, as you said, as we've closed parts of our economy. And so right now we're not seeing any kind of budget cuts. But even if we do, I have to say we have managed through that in the past. We've had a zero budget growth since I've been here since 2011. And for those that have been back with me during that time, we have continued to deliver services to our partners without missing a beat, continuing to bring on new partnerships and programs, I would say. So I'm not foreseeing any kind of cuts at this time, but I also want to have a caveat with that in case something changes. But right now, I think at least for this year, it's probably going to be the budget's going to be the same. I think if we see anything, it may be next year, because, it also depends. The sooner we can open up, the sooner we'll know what we're looking at. Is this a year-long recovery, or is this an 18-month recovery? And let's pray that it's not any longer than that.
Okay. So many of the folks on the call with us are small business. And some of them are tied to the hospitality and tourism sector. One of the great challenges has been that many of the financial resources that have been put out by both the state and the federal government, we thank our leaders for all the work and the scrambling that's been done to make those available. But there are still people that are falling through the cracks. There are still
Correct.
some that are not able to qualify for a whole variety of reasons, like seasonal businesses, for example. Do you have any words of encouragement, any insights, any new things that'll be coming down the pipeline?
Well, first of all, you are correct. I mean, I do believe the Paycheck Protection piece of legislation, it does sound like Congress has reached an agreement so we can open that back up, is actually an incredible program. But there was a large group, the 501c6s, that were left out of that. And that, of course, affects all of our Chamber of Commerces and a lot of our associations that are so vital to that community health and having the pulse in that community. I had hoped that we could get that remedy in this next round. I do not think that's going to happen. I have not seen any indication of that. I think that when we deal with nonprofits and a lot of our larger, if you will, consumer-facing tourism kind of industry, seasonal things that you're talking about, that's going to have to be a longer conversation that we have as part of this recovery plan of how do we stabilize that industry. As you know, that we did put out $24 million of the Small Business Relief Grant. I think you had 13 awards, about 264,000. Even though we do have a metric and a screening process that we went through that was thoughtful, I did prioritize and give that money out the door, those that scored with the highest loss, that we looked at the documentation, but more importantly, those consumer-facing organizations that were forced to close very early on proclamation. The intention is, and Governor Reynolds has said this publicly, as have I, that with the $1.25 billion grant that will be given to the governor to be used at, from what I understand, her discretion by Treasury, that it is our intention to put more money into that round and to finish those small businesses. So let me tell you, if we're able to do that, and we've got the money in the bank, the problem is they haven't told us how to spend the money. And the problem you don't ever want to do with the federal government is to get ahead of them. Because if we got ahead and awarded it, and then they said that's not an eligible expense, then we have to pay that back, and we don't have the resources to do that. So we're being cautious, but what I can tell you that we have 1,000 awards, 1,000, ready to go out the door the moment I get clearance that this is okay. And in that group, you're going to see a more diverse group. You're going to see, yes, some Main Street retail. You're going to see a lot of hotels and, you know, limousine services. You're going to see some more hospitality groups, not the big groups like the large conglomerates, because that's going to be a different funding need, right? But the small boutique hotels and individually owned kind of facilities in our community. You're going to see that, and it's ready to go. We're just waiting again on that guidance. So every morning, the very first thing I do every morning and the very last thing I do at night before I go to bed is I text the governor's office and say, can I release money tomorrow? I have not gotten that go ahead, but I can tell you we are ready to go. Because we know there were a lot of other worthy applicants in that pool that we just simply ran out of funds.
You make it sound like it might be imminent if you're checking in twice a day. So you're really just waiting for that federal money to hit the state. Is that correct?
We actually have half the federal money. That's the crazy part about this. The money's actually, half of it's in our state checking account, but we can't spend it until we know. Now, there are some things we can spend it on, like PPE, replenish stuff, that the kind of expenses the government has used for PPE. So we can reimburse our treasury for that. You know, this was a brand new program. This is something different. And so we have to get very clear guidance, because again, we would have never set up this program had it not been for COVID-19, right? This is not something, it's not a normal program. You know, we don't even have any rules on this. I mean, we created a program and put an application together and got it out the door in record time. And so we're hoping that they'll see, as we do, that this was a COVID-19 response and that we can have that funding. So yes, we should know this week, I'm hoping.
So the previous announcements have indicated that it would be, if additional dollars become available, that it would go first to people whose applications are already in. Is there a possibility that new applications
No.
would? No. So
No,
what's
I'm
in is
sorry.
what's in.
No, we're only going to work through, because let me explain, let me give you a perspective. You know, one is, you know, we had the number of applications. You know, there's probably 14,000. It'll be less than that when we finish doing the final screening on duplicates. The number of applications and the assessed need, right? So not just what people ask for, but what we determined based on our screening process, what the revenue loss was, is exceeded $140 million. So put that, we only got 24. So if you put in that perspective, the answer is no. The first thing is, the program was only designed to be a 30-day stopgap until Paycheck Protection and some of these other SBA loans began to flow. Now, we have certainly moved past that, right? And so when it reopens, the only thing that will be different is we are going to ask people that we award funds to on the contract to check a box. And that box is saying, if you have no intention of reopening, you should not accept this money, right? Now, if you take the money and let's say 60 days, you still can't make it work, we're not going to go back after you on that, right? But if you know that your decision has already been to close, we're not going to let you take the money. We want to give that to somebody, because then it's going to be more of that reopening. And so that's the process. We're not going to do a new round. You know, first of all, I still believe, and that gets to the second thing that's so important, this Iowa testing that the governor rolled out, Test Iowa, yesterday. It is absolutely critical, and I will be sending you a email later encouraging you to send out to all of your members. The more testing we have, or know the assessment of knowing who needs to be tested, the more we can begin to really figure out how do we open this economy back up. And that's really what this is all about. This is getting people back to work.
Sure. I appreciate that response. Again, and I'm sure you're hearing this from other sectors and communities, there's just so many that have fallen through the cracks of the Payroll Protection Program. For example, our casino would count as that. And that's an employer of over 600 that doesn't qualify for anything, and yet those jobs and ripple effects. So anything that we can do to partner with the state of Iowa to continue to have conversations with our federal leaders would be really important, because there are industries that are falling through the cracks. There are businesses that are falling through the cracks, that they don't qualify for anything.
Yeah, there's no doubt about that. And that is certainly heart-wrenching. But, at the same time we were setting ours up, we did have a line of sight. So for instance, the expansion of unemployment, it's not ideal, but, we got emergency provisions that sole proprietorships, contractors, people that normally do not qualify for unemployment now qualify. And of course, right now they have that extra $600 a week for a period of time for people on unemployment. So that helps. That when you start looking at, though, a large part of the larger people, like the casinos, and I would argue with you on this one, on casinos and some of these larger employers, their ability to get capital is different than a Main Street company, right? So I'm hoping down the road you're going to see things like another infusion of what happened back in the last recession and big flood, the Midwest disaster bonds, right? If we had disaster bondings, it's the kind of capital funding that a place like a casino could utilize to get back going, or your larger employers over that 500.
Sure. I want to remind everyone on the call that there is a chat feature located at the bottom of your screen. And we are accepting questions for Jeremy Hess to kind of sort through and consolidate and be asking of Debbie here shortly. So I'm going to hand it over to Jeremy here in just a minute. So Jeremy, get ready. But before I do that, Debbie, I'm sure that you come into, and again, thank you. I know you're exceptionally busy. I know you've done some of these calls with other communities. Mm-hmm. You must come into them with a little bit of this is the message more than anything else that I want to make sure I get out there. What would that be? What is the number one thing that you want these business leaders to be hearing from the Iowa Economic Development Authority?
Well, that's a great question. And first of all, I want to be hearing from you. So here's there's a couple of things a couple of things you can do to help me. One is, again, encourage all of your members and have them do this testing assessment. That's number one. The second thing is that you helped us at the beginning, because we got out in the field very early on, one of the first states to do this, to do that surveying that we did in partnership with you and I. Those executive summary results are on our website. In fact, if you go to www.iowabusinessrecovery.com, the results are there. If you want individual aggregated results for your region, Drew at you and I, in the Institute of Decision Making will provide that to you. And the second thing is that we are going to go back out into the field with them on May 1st. And I need you to help get that surveying out. I am very sensitive that people have enough to do. I do not want to create survey fatigue. But what people have to understand is, one, there may be other surveys, but the one that we're doing is the only one we're paying attention to, right? It is the official survey of the state. It is giving us guidelines of what we need to do and what we need to hear. The other thing is, as you know, I'm extremely accessible. People can contact me directly via my email. I answer every one of them. Or they can go to or to go to iowabusinessrecovery.com, right? I mean, is that the email address? Mm-hmm. The email address, I'm looking around like, well, we'll tell you. Yeah, did you get that? Business Recovery at iowaeda.com. That one is also being staffed by a group of our team members. So if you have individual questions, but if there is something you need me to know, then reach out to me directly. But the surveying and the testing are really the most important things. If we get anything out of this call, that's what I really need to stress, where I need your help.
Okay. Thank you very much for that. Jeremy, are you ready?
Well, sure. I've got a few questions that I'm going to try and work through. Hi, Debbie.
Hi, how are you? I love your painting, by the way.
I'm good.
Very nice.
I'm
loving that I get to see everyone's homes. Yes.
Yeah. Look, I'm really needing to get to the salon, though. Look at the roots of my hair. It's just terrible. I mean,
I love it. I love it. Yes, awful. But I do love seeing people's homes and their pets and their children. I mean, it's certainly been a bright spot of all this.
Yeah. Hey, you kids, shut up back there. So, hey, look, I'm going to give you just another run at this a little bit. I we feel a sense of in our area and all across the country of just wanting some hope to hold on to, and where's the light at the end of this tunnel. And so I know the governor is thinking through a strategy of how to carefully and safely begin to roll things open. And so can you just share with us what you know of some of those metrics? And I know you talked about the testing a little bit. What's all behind that as we all look forward to, we're ready for a dawn from these darker days. We're ready for dawn to break. And so what can you say to just encourage our members and the folks watching today?
Well, I mean, honestly, when it comes to opening up the economy, it really is based on what Department of Public Health is telling the governor first and foremost, right? It's Dr. Pedotti and looking at the curve. As testing goes up, we're going to see things peak, right? I mean, let's be honest, the more testing we get, they're looking for a plateau, or really a flat line for a period of days. They are looking at it region by region. I will tell you, community by communities, to see if that makes a difference. Believe me, the governor knows, because she knows it personally, intuitively, but I tell her every day that of course we want public safety. The worst thing we can do is to open up and have to shut back down, right? So it's going to be interesting, a couple of other states like Georgia and Texas, what they're doing, to see how that goes and see if they have an increased spike. But the governor also knows that it's not sustainable, that the longer we keep people, this economy shut down. And let me also say, though, first of all, I have tremendous respect the way she has managed and led this entire, led us through this so far. She's very measured. It really is based on data. It's not based on emotion. She made the right decision not to shelter in place. And I can tell you how many communities, mayors, and county supervisors, thought that was a really bad idea. So can you imagine where we would be if we shut down so much of our economy that we're really the manufacturing, the processing, that essential service part of our economy? So we've done it measured, but she knows Main Street. She knows small businesses need to be able to open their doors. It's not sustainable. But it will be that's going to be really led by the Department of Public Health, as it quite frankly should be, right, at this point. So it's the testing, and it really goes back to that. The more we can do, I did my personal assessment. It says that I'm not at risk at this point. I have no symptoms, so I didn't need to be tested. But it's a great tool for us to really see what truly is happening across Iowa.
Okay, well, thank you for that. So generally, I try and wade through the questions in the chat and not get too specific. But we're not getting a ton of questions today, but a couple of them are coming into one segment. So
Okay.
I don't like to read a question, but I'm gonna read a question.
Sure,
So
sure.
the CARES Act includes $100 billion public health and social service emergency fund. So there was $100 billion set aside for that. 30% of that has been distributed to Medicare providers. We have a local agency like Hope Haven that would benefit from regulatory language that requires a portion of the remaining funds be mandated for Medicaid home and community-based services. So that's a huge service that they provide in our community and so forth. And so could we consider advocating to our senators for this kind of regulatory language that would help maybe drive some of those dollars towards that specific purpose?
Okay, so first of all, you do realize that's a bit out of my scope, but here's what I will do. Send that one to me in an email, and I will forward it on to both our legislative liaison in Washington that works for the governor's legislative liaison, but I will send it directly to the department where that needs to be, because I simply cannot answer that question, but I'm happy to be involved in making sure that that gets transferred to the right person so we can get that answered.
Yeah, thank you for that. And there's probably a couple more questions that I'll follow up, Debbie, with you on a private email to forward the very kind of narrow questions and so forth. So what's your understanding of how the governor is putting together the task force and how the process might be as far as reaching out to different segments? Got a lot of people that were ready to raise their hand and say, I'd be willing to be a part of that and so forth. So maybe speak to that a little bit.
Well, actually, I don't have all the details of that, to be honest. We have certainly identified the stakeholder groups and obviously the business community, the chamber alliances, the groups that you're associated with, we have identified as a stakeholder. But how individual, I think what is going to be left is up to each individual chair. There's going to be several different subcommittees. And so I could see that there will be people that will want to serve not on just one, like from the Chamber Alliance, but that may want to serve on several different ones. So again, everything that we're doing that has to do with recovery, has to do with setting that strategic plan moving forward, or anything that has to do with relief to the businesses is on that website, iowabusinessrecovery.com. Very proud of it. We actually keep it updated. We'll connect to other agencies like IWD, those agencies that are also facing the economy. So that's really the place where all of that is going to be kept. So I would encourage you, if not every day, to just refresh that page and be on it to see. It also has things on there like when we did the public service announcement with Ashton, we did that through our organization. That's on there. So anything like that we have, that's the first place it's going to be.
Okay, great. Hey, one of the things that I know that was, I believe, passed today at the federal level was some dollars set aside for additional testing and for hospitals and healthcare and so forth. And so what can you tell us about that as far as locally or in Iowa, how those dollars will be set aside, what's that for, and how does that help us move forward?
Well, I think anything that we can do, anytime the state can get reimbursed or opening up a different revenue source to have the testing. I mean, it really has all been about the testing, right? And the need to do rapid testing in the state. So I think that's good. I happened to be on a call with CEO of one of the largest healthcare systems here in Iowa. And of course, obviously, it's staggering the losses that they're seeing today due to closing down of elective surgeries, right? And we've seen that have a ripple effect with, of course, the doctor's office and everything from even physical therapists and everyone that's in that supply chain we've seen, of course. So I haven't seen specifically what's in it for them, but I know that certainly relief is needed for that. If the other one we have to deal with is, what losses to the individual municipalities and counties, the city and county hospitals. I mean, all of that's being done. There may be a role for some of that with IFA, with our bonding capacity. The Treasury is opening up some liquidity opportunities for us that we're still exploring. As soon as we know the terms, we'll certainly look to do that, especially to help some of this replace funding for the municipalities. So there are all kinds of things we're doing on the IFA side. Again, so much of what we're doing is, and I really applaud our federal partners and the SBA because, they've gotten money out very, very quickly. They've leaned down their processes. And so much so that, again, they're giving us money, but we don't know what the guidance is. And it's the same thing on some of the liquidity issues. We can put some more bonds out there and help our cities and counties, but if I don't know what the terms are, right? If the terms are something much higher than what they can get by doing their own, it doesn't make sense for the state to do that. So those are the kind of things we're looking to Treasury to answer for us.
Okay. Well, Debbie, I'm gonna tiptoe into this one a little bit. And
you don't need to tiptoe with me. We go way back.
I just come kicking then. How about that?
Okay.
So today, I personally, I went to Menards, okay? Yeah. And so parking lot's packed, people standing in line, and everybody's doing their thing and whatever, and that's fine. I'm not making any judgment. Don't judge me. I had to get something. But so how do we talk about the big box retailers that can remain open and they're smart enough to self-space out and all of those things versus our smaller retailers, and just how do we see that? I don't know, just there it is.
Well, it's very frustrating. I had a call from a personal friend of mine that runs a jewelry store in Sioux City that was forced to close by proclamation, but yet if I went to Sam's Club, I could buy jewelry. Couldn't buy the same jewelry, right? It's not the same selection, but is that fair? And I think those are valid points, right? And so I think that really all weighs in to how that we do need to open this economy sooner. I mean, we may have to, if it goes on much longer, we may have to talk to those essential businesses to basically tape off some of their sections that, you know, for instance, I don't know, now this will show my age to those of you out there, and I can't be the only one that remembers this, but I remember when I was a young girl that on Sunday, first of all, you couldn't do anything on Sunday for years, right? Then they started opening stores, but you couldn't buy alcohol, and they would have half the store taped off because there's certain things that people didn't consider essential, right? It was, I think it was called the blue law or something, if I remember correctly. So, you know, we may, if the longer this goes, we have to, I think that we do have to talk about those things because there is a sense of fairness about that, right? But you're right, the big boxes that I have been involved in, the grocery stores, they've done the plexiglass for their tellers, they've done the, you know, the taping on the floor, you know, so they are doing what they can. But again, it is our desire that we open this economy back up.
Yeah. All right. Well, thank you for that. And so any way that you can speak into any data that shows that, or what the state is looking at? There's a, I don't want to call it a conspiracy theory, but there's a theory that maybe this virus has been around a little longer than some people know. And so how do we go about, what's the state planning as far as doing what's the test to see if you have the immunity or,
oh,
you know what I'm talking
immunity
about?
tested. Yeah, I actually do know that they've been looking into that. And of course, I find that personally quite intriguing because I think, again, that just helps us give us more data. I have to tell you, that's not my area of expertise. So I don't know the particulars of it, other than I do know the Department of Public Health and Dr. Padati and all of them have been looking into that. I think it is important to know who's immune to this, right? Because then you can put them more on the front lines as we begin to open up. I think the other thing that we have to keep in mind, and just to kind of manage expectations, as we look to reopen, you know, it's not going to be everything all at once, right? It will look different, and I think we have to prepare ourselves for that. And part of it is at the same time that we reopen and we start bringing people back. And so restaurants will probably have to do some type of social distancing for a period of time, right? They'll have to be looking at the layout to make sure they may have to remove some tables. So we're going to do that in our break room when we start bringing our employees back gradually. Because we also have to build consumer confidence. And it really is about that consumer, right? Now, you have to also weigh that there's also pent-up demand, that, you know, people will become very weary if they don't see us beginning to open things up. So, but I think we have to look at that when we open, it will be a process, and we will be following that process. It will look different for every industry. It will look different for every, because again, you know, we're putting together our reopening plan at IEDA and IFA. And presenting that to the governor of how we think we can begin to transition our people back to work, because we have, again, a handful of us here every day, but most people are working at home.
Yeah. So sometimes there's things that happen within our region that affect the whole nation, and one of those is the Tyson plant up in Columbus Junction.
Yes.
And
yes.
so I know that there's been steps there. Could you share with us any thoughts you have, or what you know about how that can move forward?
Well, first of all, the governor personally was involved in getting some rapid testing in the Tyson plant area, as well as with like National Beef and Tama. I don't know how many of you in your membership have been in a packing plant, but I've been in my share. And if you go into these packing plants, we're talking about the protection that they already have to wear, the sanitation, because we're talking about our food supply. So it really gets to not so much what's happening on the floor, but what gets into the way people are coming to work. I've talked to many of the CEOs. They're staggering the work times. They're staggering, again, where they can be together in the plants. But let me also say this. There's a certain amount of responsibility we have individually that after we leave our workplaces, right? And to make sure we continue those safety processes and we consider that distancing, because they are critical to our supply chain. So we are concerned about that. So much so that I'm even going to be having a call later today with one of the organizations to just see how we can help them get back to work. and get that confidence out there with employers. But again, if you go in these plants, these people are covered in gowns, they have gloves, they have hair nets, they have, you know, they're giving them face masks now. They have to, when you walk in a place where you can't even bring stuff in on your feet because where you have to step in a pool of cleaning fluid. I mean, so these, again, they're food grade. I mean, they have USDA inspectors there every single day in these plants. So it really is what's happening, not so much on that plant floor, but what's happening, getting them into the plant floor, after they leave the plant floor, and more importantly, what they're doing after they leave the plant.
Yeah. So last question from our panel here, or from the chat side of things. Do you anticipate, Debbie, that there'll be some fairly specific, as much as they can be, guidelines given to businesses as they open,
Yes.
like social distancing, or will each business determine that for themselves, or how do you see that rolling out?
I do think we'll be giving guidelines. Like, for instance, I know the restaurant and hospitality industry has already provided myself and the governor's office with things that could be done, what they would prepare for as an industry, things the industry would support, things like having paper menus, right, that are disposed of, those kind of things. So yes, every industry will look a little different, but we will certainly be providing guidelines to help with that.
Great, thank you so much. So I'm going to turn it back over to Della and Debbie. Thanks for your time, and I will be following up. I got a couple narrow questions that I'll email you, and appreciate the response to that. Appreciate it. Thank you.
Yeah, we'll get those answered for you.
Well, Jeremy, thanks again. You always do such a good job with that Q&A and reading the group chat. And I want to give a shout out to our team. I know you know this too, Debbie. It sounds like you got a support group there, but we continue to do those things that people think just happen. And
yes.
with a great team at the partnership office that coordinates and makes all this happen. So shout out to those folks. Thank you for giving us so much of your time. Again, I know that you are tremendously busy, but it is so important and so helpful for our business leaders to be able to see you and hear from you, to be heard. So thank you for that. We look forward to more information coming. And I appreciate how responsive you are. I carbon copied you on an email just to keep you in a loop, and I didn't expect to get a response back from you. And I did so quickly. So I appreciate that. And we will take those 2 requests that you made of us and make sure that we push that information out and participate, because that's our path forward to opening up this economy.
Yes.
And to Jeremy Hess's earlier comment, that's what we need more than anything else right now, is an understanding of where that dawn is at. Where is the light at the end of the tunnel? So anything we can do to partner with you to help get that message out will be phenomenal. Is there anything that you would like to say before we conclude this call?
Well, I do want to say that I do want to leave it on a positive note. I am extremely optimistic about what I'm seeing as opportunities going forward. If one thing that we have learned during all of this, we've learned where we have some weaknesses as a state on infrastructure, some things we can do, but we have an incredible opportunity to chart out a really very robust future for us, and some new programs that we're going to do. I'm really excited about what we see. So I'm anxious to get the economy open so we can all go back to work and we can start setting a different path forward.
Well, thank you so very much for that. Thank you for everybody who joined us on our call today. And that will conclude our session today with Debi Durham.